lower payments for indigent and cat fund, which would allow them that money to be shifted to be used for our share of the Medicaid,
Okay.
or perhaps even cost share reduction. And it's certainly an opportunity for better management of high-cost conditions, which we identified on enrollment or at the onset of conditions through claims. Okay, and for the insureds, of course, is a 20% reduction in premium. And next one, I think that's it.
But those are,
What's next? Oh, okay.
those are those insured through the healthcare exchange, not those insured through employers.
Right, right.
So
This
there's a whole-
this is part of the ACA
Right.
and Medicaid. And it doesn't have to do with employer-based insurance. Now, is there any reason that you couldn't do this similarly with large group or small group insurance? Conceptually, you could do it with small group pretty easily. Large group that are multi-state would be difficult. But anyway, let's one step at a time. So the waiver applications have been submitted. If approved, it needs to have action by the legislature and the governor. What's your feeling, Dan? Shirley, do you have any idea? I have heard less resistance to this than to Medicaid expansion. That doesn't mean it's support.
I'm gonna stop you right here for just a minute. I have two quick announcements, and then anybody who wants to stay and talk about this and ask questions, you're welcome to do so. But our time is 12 to 1. We have no more programs until January. Look in the paper and they'll be listed.
January 24th.
January 24th. And Dr. Schmidt has a petition back here that has to do with what we've been talking about and expanding Medicaid in Idaho. If you would like to talk to him or sign it, please see him afterwards. Thank you all for coming. We appreciate it very much. If you want to continue to talk to
I'll be just a minute or two. The petition is for direct expansion of Medicaid. It is not for the waiver program. It's a perfectly valid alternative, but that's the one that's been rejected by the legislature year after year. So is that going to work or not? I don't know. Anyway, so I think the biggest issue is the uncertainty in the federal government. You know as well as I do. They want Obamacare gone, but they want the states to handle things, so who knows what we're going to decide. Yes, ma'am.
So the applications have not yet been submitted. They are accepting public comment through this Friday.
You're right, you're absolutely right.
Yeah.
They are accepting, and you can do the comments on the either the Department of Insurance or Department of Health and Welfare websites.
And Close the Gap Idaho.
When I said that this has been a negotiation process with the feds, so they have the final construct, now they have to get public comment, and they send it in, and then they have 60 to 90 days to offer, either to say, yes, it's okay, no, it's not, or we need more time. Yes,
Just wondering how the waiver, how it works, basically the waiver system, how would it work?
well, you apply to the feds to say, this isn't exactly the way we're doing it now, or the way the law is written, but if you grant a waiver, you'll get a better deal. And I go through the issue of what the waiver includes and how it will be handled, what the estimates of costs are, and then send that back to Health and Human Services or to healthcare.gov, and the feds say yea or nay. Several states have applied for waivers. Alaska has one that's condition-based. What they do is they pull them out and put them in a high-risk pool, not on Medicaid. You know, if you think about it, renal disease, certain pregnancy conditions have already been pulled out and put into Medicaid. So they're already selecting out some disease conditions to handle that way. Why not these other ones? So, yes, sir.
I'm just confused about one aspect of this waiver proposal. So,
Only one.
would you then force people to go on to Medicaid?
No,
You know,
it
how
would
are you
not.
going to get the best?
Would not be forced.
Why would a person want to go on to Medicaid and
You
get
have better benefits and you don't have a high deductible or co-insurance.
even though some of the benefits might be a little
I'm going to suggest that the Medicaid benefits are as good as any commercial plan. The payments to the providers may not be as good. The benefits for the individuals are as good. Yes, Shirley.
When Truman was trying to get something.
Yeah, she remembers that.
I do. As a matter of fact,
You were about 10 then, weren't you?
the American Medical Association opposed that and raised more money to oppose it than any lobbying group had done up to that time. And looking at trying to negotiate with doctors today, depending on a doctor's specialty, many of them make more money than they can reasonably spend, probably. And it isn't really easy necessarily to get doctors to agree to take Medicare patients where they have to negotiate those rates. If you know people who have lost their Medicare and go around looking for a doctor that will take them. So if we put doctors in a situation where they have to negotiate the rates, which is going to be involved here, do you think that's really going to fly?
Well, most
like
of the
it needs to?
negotiation is not done by individual doctors, it's done by organizations. Medical or health associations, or, as is happening more often in this country, health systems, Providence, Kaiser, Trinity, Catholic Healthcare West. Those systems that own doctors' clinics and pay them salary plus a bonus are the ones who negotiate with the payer. And that's why that consolidation gives them a big stick and say, I'm the only hospital in 200 miles. I have 2 hospitals and I'm the only ones in 200 miles. And oh, by the way, I have all the cardiologists and gastroenterologists and orthopedists. So now come and talk to me about how much you're gonna pay me. So that's the kind of consolidation that we're seeing in most of the country, and we're actually seeing it here too.
Have you ever in the
Moscow, Idaho, and Lewiston, Idaho are kind of backwaters.
We are going to have to close. We have to respect the fact that other people
I
get
signed
to
it
too.
already.
So this is obviously a complex situation.